I am Dr. Jane West, and I'm going to be talking about benign breast masses. To start off things, we're going to first look at a normal ultrasound. Anytime we look at a breast mass, we will do an ultrasound to further evaluate the characteristics. For this normal ultrasound, up top, this is the skin, this is the breast tissue, and this would be the chest wall. The normal breast is comprised of the fibrous tissue and then the fatty tissue. The fatty tissue should appear medium gray and should never appear black, and the fibrous portion of the breast is always a little bit lighter in color. On this normal picture, we do not see any mass or other sonographic abnormality. Here's our first case. Again, this is the skin, this is the breast tissue, and if we went deeper, this would be the chest wall. Within the breast, we see a well-circumscribed anechoic mass with enhanced through transmission. What that means is this area that's brighter behind the mass. This is brighter because our echoes are going from the top and it's going through this cyst. And it's brighter behind it because it's like going through water and it's just transmitting those echoes. Where on either side, it does absorb those echoes, so we don't get that brightness. This is our imaging characteristics of a simple cyst, which is a benign etiology. There is no internal color flow. These are benign findings and they can safely stay in the breast. They can fluctuate based on menstrual cycles. We can aspirate these if they cause symptoms such as pain for the patient. Otherwise, it's benign and the patient can return to screening mammography. Here's another case that looks a little bit brighter on here just to show the characteristics a little bit better for the presentation. Again, we have skin, we have the breast tissue, and then deeper here, this looks a little bit different. This is actually implant. This is the implant capsule, and this is the implant here, and this would be a saline implant. For this, we see that there are multiple masses versus a lobulated mass, but these look like they're multiple circumscribed masses adjacent to each other. As compared to the simple cyst, which was entirely black or anechoic in the middle, this has internal echoes that we can see here, and you can perceive that there is that enhanced through transmission. For this, we don't know if this is solid or if it's cystic. So this would be something we'd do an ultrasound guided cyst aspiration with possible biopsy. So we'd go in, try to drain the fluid. If we're not able to drain it, we get a tissue sample. This one, we went in, we were able to drain the fluid, so we know this was a complicated cyst, and for lack of better terms, it's kind of a cyst with gunk in it. So these echoes that we see here are debris. Occasionally, we're lucky enough to be able to see that debris floating around, and if we can confirm that there is debris floating within a cystic structure, we actually wouldn't need to do an aspiration at that point, and we can call it benign. For this, we couldn't confirm that, so we had to do the aspiration to ensure we were not seeing a solid mass. Here's another case. We start off with a mammogram. On the lateral portion of the left breast, we see a circumscribed mass. The patient comes in for an ultrasound to evaluate the imaging characteristics if it's cystic or solid. And we see a very well circumscribed oval hypoechoic mass corresponding to the mammographic mass. This has an imaging appearance characteristic of a fibroadenoma. It is the most common mass in young women. It typically presents as a freely mobile mass detected during a mammogram or a medical or screening breast exam. The peak age is 25 to 40. These can be hormonally stimulated by estrogen and progesterone, so many times we may see these increase in size when the patient is pregnant. Here's another case. This is a mammogram demonstrating a mass in the subareolar breast. This mass is mixed density, meaning it has a mixture of fatty tissue and fibrous tissue within it. A correlating ultrasound demonstrates a mass, which is a little bit difficult to see because it really somewhat blends into the adjacent tissue. But we can see this encapsulated mass right here with fibrous and fatty portions to it. This has a very typical appearance of a Hamartoma, otherwise known as a Fibroadenoma. This is a benign proliferation of fibrous, glandular, and fatty tissue. It has a classic appearance of a breast within a breast or a slice of sausage. What that means is our breast is a mixture of fatty and fibrous tissue, and so is a hamartoma, and it's an encapsulated mass, so it stands out on the mammogram and on the ultrasound. No treatment or follow-up is needed, but note is made this can be associated with Cowden syndrome. Here's another mammogram demonstrating a patient presenting with a palpable lump as indicated by this skin triangle marker. Corresponding to the area that the patient feels, there is a circumscribed high-density, rather large oval mass. On ultrasound, we see again this oval mass, very homogeneous and very well circumscribed, rather large in size. This is compatible with the benign phyllodes tumor. We never know what these are just by imaging, but these are the imaging characteristics, and this is a biopsy-proven benign phyllodes tumor. This is a rare but clinically significant fibroepithelial tumor of the breast and can resemble a fibroadenoma. It is typically large and fast-growing and requires complete surgical excision with wide margins, as these can recur. I did put this in the benign mass category, but it's important to know that there are malignant phyllodes tumors as well that can metastasize hematogenously and can be treated like a high-grade sarcoma. Overall, benign phyllodes is rare, and a malignant phyllodes is even more rare. And the last one I have is another palpable lump a patient presented with. We have the skin, we have the tissue, and then this is the chest wall here. We see this isoechoic encapsulated mass corresponding to the patient's palpable lump. This is compatible with a lipoma, which is a soft, painless, mobile mass. It contains fat, and sometimes it is hard to see and tell the difference from the adjacent tissue. It's typically isoechoic to hyperechoic. No further treatment is recommended. However, if there is any enlargement, a biopsy could be considered at that point. These are just a handful of the benign masses that we can see. And things to think about when you go through and you look at the ultrasounds when you go on your rotation.